My family history of breast cancer is long. One of my aunties died like 4 years ago. My sister has it right now. And my auntie, the one that I was raised with, she also got it. So when I felt the lump, I immediately felt scared. The first thing I did was I went to my OB because I was pregnant. I was 24 weeks pregnant. And yeah, they did a biopsy and everything, and they diagnosed me with cancer at 24 weeks of my pregnancy. First, they sent me to one surgeon, and I felt that he didn't want to take the case. He mentioned that it was too risky. And then the first surgeon recommended me the second one, and then the second one, the third one. And that's how I got to Dr. Holmes.
Vanessa had a type of breast cancer called triple-negative breast cancer. It is the most aggressive type of breast cancer that we face today. It's one that is only treated with chemotherapy, and unfortunately, it's a cancer that is likely to grow and spread if it's not diagnosed early and treated effectively. There was this urgency to do something, and at least before I met it didn't seem that things were happening, which is why, we felt it necessary to take control of the situation and to make sure that she accessed the care she needed.
He was the only one that looked like he knew what he was doing. Right away, he told me, okay, we're gonna do this and that. And he explained everything to me, and I was like, okay, I was supposed to go with him for a second opinion and then go back with the second surgeon. But I didn't want to go back. I stayed with Dr. Holmes.
When I met Vanessa, the first thing I felt was, this is a young lady dealing with a breast cancer diagnosis who's trying to, have a child. And this is an emotional crisis, not only that she's experiencing, but that it's affecting me and my staff. And it sort of bolstered our commitment to work with her.
Knowing that I might have to end up the pregnancy way sooner, I think that was like the most scary part for me because I wanted my baby to be okay.
Pregnancy during breast cancer is a relatively uncommon event. So having an expert team that knows how to manage and coordinate the care so that you can do all the things that are necessary without unnecessary delay is crucial to getting the patient and the baby through the experience with the least harm.
She was born at 33 weeks and 6 days. When she was at the NICU, she was born fine, but then she got an infection. So I cried. I was really scared, and I couldn't stop thinking about my baby should be in my belly right now. And yeah, but now she's okay. 2 weeks after she was born, I started chemotherapy first, and then the surgery. Knowing that, you're gonna have your breast removed at this age, yeah, it was hard. But when I got there, how I said, everybody was so attentive. They made me feel comfortable. And I could see that everybody was doing everything they can. It makes you feel safe and comfortable. And I think that's really important for us to feel at that moment that you're going to be okay.
Gracias. ¿Cómo te sientes?
I actually feel stronger because I feel that if I went through all of this, I can go through everything.
Breast cancer treatments, chemotherapy, surgery, the recovery, it's not an easy process for a woman to go through. And certainly, for a young woman who's trying to, have a baby, there's certainly a lot of motivation there. But they also have to recognize that it's not just a goal of trying to get through the pregnancy and having a baby, but there's a life to live after that, and that they need to survive, their baby needs to survive, and they both need to live on, for a full life afterwards. And I think she had, again, the right attitude of, to take this on, and that inspired us to work harder to care for her.